Hello friends, welcome back to Cortex YouTube channel once again, and in this video I will be teaching you a easier way of understanding the prophylaxis of infective endocarditis. So we will discuss in this in a question answer format. Like, first question is, who should receive this? Who should receive the prophylaxis? Second question is, what drug to be used? Okay, what drug and who? So these two questions has to be answered in the prophylaxis of infective endocarditis. So first question is, who should receive? So infective endocarditis, those who have high risk cardiac lesions. High risk cardiac lesions. So what are these high risk cardiac lesions? It is nothing but your CHD. CHD here stands for congenital heart disease, and CHD also is a mnemonic to remember the high risk cardiac lesions for infective endocarditis, where C stands for obviously congenital heart disease. Congenital heart disease here, like unrepaired cyanotic congenital heart disease, you have to give prophylaxis. And completely repaired, you have repaired it completely repaired congenital heart disease, in the first 6 months you have to give infective endocarditis prophylaxis. Then you have repaired CHD, but there is residual defect, repaired CHD with residual defect adjacent to a prosthetic material, okay, or prosthetic wall. This is about congenital heart disease prophylaxis. Here H stands for history of infective endocarditis. Okay, before that I would like to mention one more C, which stands for cardiac transplantation, post cardiac transplantation valvulopathy, post cardiac transplantation valvulopathy. And H stands for history of infective endocarditis, previous history. And D stands for devices. Devices are nothing but your prosthetic valve or left ventricular assist devices, or pulmonary artery valves. Pulmonary artery valves are conduit placement. So all these conditions constitutes high risk cardiac lesions in which you have to give infective endocarditis prophylaxis. So mnemonic is CHD. C stands for congenital heart disease, and C also stands for post cardiac transplant valvulopathy. H stands for history of infective endocarditis. D for devices. So in these patients you have to give infective endocarditis prophylaxis. So second question is, what drug should be used? So for that you have to know whether the patient is having penicillin allergy or not. Penicillin allergy. If patient is not having any penicillin allergy, no penicillin allergy, you can use either oral or IV tablets. So oral, if the patient is able to take orally, you can give what is known as amoxicillin. So amoxicillin 2 grams per oral 1 hour before. See, all these drugs should be given 1 hour before the procedure. Okay, before procedure. If the patient is unable to take orally, so that time you can give IV. IV drug is ampicillin. Here the dose remains same, 2 grams. IV or IM, you can give IV or IM. Okay, 2 gram IV or IM. So if the patient is allergic to penicillin, what to do? If the patient is allergic to penicillin, that time you can again go for whether the patient is taken orally or not. If orally possible, you can go for few drugs like clarithromycin or azithromycin. You can also use azithromycin. How much? What is the dose? It is 500 mg 1 hour before. 500 mg 1 hour before per orally. Or you can also use drugs like cephalaxin 2 grams per oral you have to give. Or you can, one more simple drug is doxycycline. So simple doxycycline can be used as prophylaxis. So 100 mg start orally. Okay, this is oral options when patient is allergic to penicillin. When patient is allergic to penicillin and patient is not able to take orally, that time you have to give IV or IM. So that time what you have to give, I mean what drug should be used. So for that you have to know this drug, cefazolin. So you can use cefazolin or you can use ceftriaxone. How much? Here it is 1 gram. IVRIM, here it is 30 minutes before the procedure. Only difference is here it is 30 minutes. Rest other drugs has to be used 1 hour before. Okay, only here it is 30 minutes before the procedure. So this is about infective endocarditis prophylaxis. Hope you find this video useful. If so, please like, share and subscribe. Thank you.